Croeso cynnes I bawb, a warm welcome to everyone. My name is Mike George, and together with my colleagues Rebecca John and Tim Morgan, we are the Wales General Ophthalmic Services WGOS National Clinical Lead. We're focused on guiding teams, influencing change, and ensuring high standards across NHS primary eye care in Wales. We are a bridge between clinical practice in optometry and health policy, and responsible for helping NHS Wales deliver Welsh Government strategies. We're also responsible for helping health boards to deliver locally tailored, nationally aligned services, and we're here to help build a shared, clinically informed vision for eye care in Wales. I'm here to talk to you about WGOS signed orders. In this session, I will explain why WGOS signed orders were introduced, what a signed order is and is not, who may issue one and who cannot, and when a signed order may and may not be used. I'll also talk about WGOS signed orders formulary and what other NHS Wales professionals may need to know, and give you some clinical scenarios in practice, plus some details on the oversight of WGOS signed orders and the benefits of them. WGOS signed orders were introduced to address a long-standing gap in primary eye care pathways in Wales, where patients examined by optometrists sometimes needed to see another healthcare professional solely to obtain a medical prescription. This duplication created avoidable pressure on GPs and on independent prescriber optometrists and pharmacists, and also urgent eye care services and emergency departments in our hospitals. Signed orders support the Welsh Government's policy aim of delivering more care closer to home, making best use of NHS Wales's professional skill mix, and reducing unnecessary handoffs within the system. From the 1st of April 2026, community pharmacies in Wales have been able to dispense approved medicines and appliances requested on a WGOS signed order, allowing treatment to begin promptly after an optometric assessment. This improves the patient experience, reduces delays, and supports more efficient use of NHS Wales resources. Importantly, signed orders are not intended to replace other services, such as independent prescriber optometrists, eye casualty, GP care, or the common ailment service, but to sit alongside them as a proportionate and clinically appropriate option. When used correctly, they help ensure that patients are seen once, treated once, and seen in the right part of the system for any ongoing care. A WGOS signed order is a formal written instruction issued by a WGOS optometrist following a WGOS episode of care. These are routine and acute examination services, the low vision services for people with vision impairment, and specialist services for people with medical retina and glaucoma conditions. The signed order authorises a Welsh community pharmacy to supply a specific medicine or appliance that appears on the nationally approved WGOS signed orders formulary. It is important to note what a signed order is not. It's not a GP prescription or other WP10 prescription, and it's not interchangeable with prescribing by independent prescriber optometrists who have a much wider range of drugs at their disposal. Signed orders operate within a clearly defined scope and governance framework and can only be issued where there is clear clinical need identified during a WGOS examination. The supply is NHS funded and patients do not pay a charge. The intention is to initiate or change treatment, not to provide ongoing or repeat prescribing. Understanding this distinction is essential for GPs, pharmacists and other NHS Wales colleagues so that signed orders are not incorrectly rejected, duplicated or converted into prescriptions without clinical justification. Only WGOS optometrists who are included on a health board's list and who are providing WGOS 1, 2, 3 or 4 services may issue WGOS signed orders. Ophthalmic medical practitioners, contact lens opticians, dispensing opticians, student practitioners and other staff groups are not permitted to issue signed orders. Importantly, patients receiving WGOS 5 IPOS urgent care do not receive signed orders, as medicines required in that pathway are prescribed directly by the IP optometrist using a WP10 prescription. IP optometrists must also not use signed orders in practices where they hold a prescription pad or when performing WGOS 5. All their prescribing is done on their WP10s in these locations. These rules exist to maintain clear accountability, to avoid role confusion, and to ensure that signed orders are used only within their intended scope. For non-optometrists, awareness of these restrictions helps ensure that inappropriate requests for signed orders or prescriptions are not inadvertently made or supported. A WGOS signed order may be issued when a patient is receiving a WGOS 1, 2, 3 or 4 episode of care and the optometrist identifies a clear clinical need for a medicine or appliance listed in the signed orders formulary. While signed orders will commonly be associated with WGOS 2 urgent eye problem assessments, they may also be used during other WGOS episodes if clinically appropriate. Typical conditions that may be treated include dry eyes, eyelid inflammation, or ocular surface trauma. The issuing of a signed order does not change the type of WGOS episode being delivered and does not require conversion or referral to another pathway. This flexibility allows optometrists to respond proportionately to patient need without triggering unnecessary referrals or follow-up appointments elsewhere in the system. WGOS signed orders must not be used in several clearly defined circumstances. They must not be used during a WGOS 5 IPOS urgent episode, during private or non-WGOS consultations, or solely for the purpose of generating repeat treatment. They must not be used as a workaround to obtain medicines that fall outside the optometrist's competency or that require specialist management, such as by an IP optometrist or an ophthalmologist. Signed orders are also not intended for the ongoing management of chronic conditions where the prescribing responsibility appropriately sits with the patient's GP or ophthalmologist, although they may be used to initiate or change treatments for some chronic conditions. For non-optometrist colleagues, understanding these exclusions is important to ensure that signed orders are supported when appropriate, but questioned or redirected when they fall outside the defined framework. The WGOS signed orders formulary sets out the medicines and devices that may be supplied on a signed order, along with their indications and their usual place in the treatment pathways to support consistent management across Wales. The formulary focuses on eye conditions that are appropriate for management in primary care. It includes antibacterial eye preparations, anti-allergy treatments, cycloplegic agents for specific indications, and a range of ocular lubricants. Preparations are listed by generic name to support flexibility in dispensing, to reduce the impact of supply shortages, and to improve clarity in communication with GPs and other providers of care. The formulary does not replace the BNF or NICE guidance and must be used alongside them. For pharmacists and GPs, the key message is that dispensing and any necessary repeat prescribing should align with the formulary item written, using appropriate license equivalents where necessary. The formulary is hosted on AWTTC's website. There's a link on this slide, or simply type AWTTC signed orders formulary into your search engine. When a patient presents a WGOS signed order, community pharmacies in Wales may dispense the item in line with the signed orders formulary and NHS Wales regulations. The signed order will be treated as an NHS-funded supply with no patient charge. Pharmacists may dispense any appropriate licensed generic equivalent of the item listed, taking into account availability and clinical suitability. The signed order is valid for 6 months from the date of signature, and the form must be complete, legible, and signed in indelible ink with the unused space crossed out. If there are concerns about completeness, clinical appropriateness, or supply issues, pharmacists may contact the issuing optometrist. WGOS signed orders are intended to initiate or change treatment following an optometric assessment, not to replace GP care. Optometrists are required to inform the patient's GP of all medicines ordered or changed, including any advice to stop existing treatments. For GPs, this means that a notification should be expected, allowing continuity of care and appropriate follow-up by the GP if needed. If a condition proves to be chronic or requires ongoing treatment, responsibility should transition to the GP for repeat prescribing. But in most cases, there will be no need for GPs to repeat prescribe simply because a signed order has been issued. Recognizing this helps prevent duplication, reduces workload, and supports the principle of right professional, right task, and right time. Here are some examples to help illustrate how WGOS signed orders should be used. In viral conjunctivitis, supportive treatments such as lubricants may be recommended and a signed order may be offered. In this case, a signed order may be declined by the patient in favour of an over-the-counter purchase at the optometry practice or supermarket for speed and convenience. In contrast, a patient presenting with pain, light sensitivity and reduced vision, suggestive of anterior uveitis, requires urgent specialist examination under WGOS 5, and a signed order would be inappropriate. Signed orders are about appropriate, proportionate care, not automatic medicine supply, and must sit within the context of the broader clinical decision-making, optometrist confidence, and patient choice. Strong governance underpins the WGOS signed orders system. Signed orders pads must be stored securely, losses reported immediately, and blank forms must never be pre-signed. Only one signed order form may be issued per WGOS episode, although multiple formulary items may appear on that form. Optometrists must document diagnosis, allergy status, advice given, and the signed order serial number in the patient record. Health boards monitor signed order activity through dispensing data, clinical audit, and post-payment verification. For NHS Wales colleagues and stakeholders, this assurance framework provides confidence that signed orders are being used safely, consistently, and in line with national policy. WGOS signed orders provide a practical, evidence-based, clinically governed mechanism to improve local access to eye care treatments in Wales. For pharmacists, they enable timely, NHS-funded dispensing following an optometric assessment. For patients, the care is free at the point of need and timely. Signed orders mean fewer delays and fewer handoffs between different NHS Wales services. For GPs and nurses in primary care, signed orders reduce unnecessary appointments for prescribing while maintaining continuity of care through clear communication. Most importantly, signed orders support a more integrated primary care system where each professional group in Wales works at the top of their licence and care is delivered in the most appropriate setting. A shared understanding across our professions is essential to ensure that this new pathway delivers its intended benefits safely and effectively. Diolch yn fawr am wrando. Thank you very much for listening.